Is diabetes a communicable or genetic disease?
Communicable disease is usually a disease which is spread by a particular microorganism. So, in that sense, diabetes is not a communicable disease, it's not an infectious disease. As far as whether it is genetic, yes, there is a genetic component to diabetes. So, type 1 diabetes, type 2 diabetes, and also gestational diabetes have a genetic component to it. So, if there is somebody who in your family who is in your near family, who's a near relative to you, who has diabetes, then you stand at a greater risk of developing diabetes. So, in that sense, it is a genetic disorder. But genetics is not the only part of diabetes. So, it is not absolutely 100% sure. You cannot be 100% sure that you are going to develop diabetes if a first degree relation of yours has got diabetes. So, there is some genetic component to it, but there is also what is known as environmental factors at work. So, environmental factors refers to a faulty diet and a lack of physical exercise, which is of course very common these days. So, a diet which is faulty and a person who does not exercise both lead on to development of obesity, and that also tends to play a major role in the development of diabetes. This is of course type 2 diabetics, 2 diabetes that we are talking about. In type 1 diabetes, there is a genetic component again, but the environmental components are still poorly defined. So we are still not sure what exactly are the environmental triggers for a person who develops type 1 diabetes, because there are several cases of type 1 diabetes. In fact, the majority who do not have any first degree relation with type 1 diabetes, and yet they have developed that. So the environmental reasons for type 1 diabetes are still quite obscure.
Can I get diabetes even if I don't have a family history of it?
The short answer is yes, because there are both genetic and lifestyle related factors at work. So it is quite possible that even though nobody in your family has diabetes, you could still develop diabetes, and that in the case of the vast majority of people, that happens because of the fact that people follow a lifestyle which is fundamentally defective. So a lifestyle where the diet is inappropriate, which is which is poor in nutritional value, excess of carbohydrates are present, a lifestyle which has very little room or maybe no room for physical activity. That kind of a lifestyle tends to promote the development of diabetes.
Why is diabetes so dangerous and why it is spreading so quickly around the world?
Why is it so dangerous is because of the complications that come about as a result of that hyperglycemia that occurs. So the complications are the damage that the hyperglycemia tends to cause to major organs of your body, such as the heart, the brain, the kidneys, the nerves, the eyes, the liver, and so on and so forth. So the major organs of the body tend to be impacted adversely as a result of sustained glucose elevations within the blood, and that leads on to more serious complications in future, such as heart disease or stroke or kidney failure, the development of various kinds of eye disorders such as retinopathy, which can be irreversible. And so it's important to remember that because of all the various important organs which can be damaged as a result of diabetes, it is a dangerous disease and it should be therefore taken seriously. The reason for this explosive spread of diabetes, and it must be remembered that we are talking about type 2 diabetes indeed, which is exploding at a great rate. And the rate of growth of type 1 diabetes is nothing spectacular. It is type 2 diabetes which is causing the explosion of diabetes. The reason for that is the change in lifestyle that has occurred over the past few decades, maybe the past century, where we've had a progressively urbanized, industrialized lifestyle in which there is very little room for physical activity, very little room for removing stress from the body. There is a progressive increase in caloric intake. So there's more of food that we are ingesting. There is more of unhealthy food that we are ingesting. And all those factors in combination are really what are responsible for this exponential rise in diabetes.
Can a person have diabetes without symptoms?
Yes, the person indeed can be diabetic without symptoms. We have patients who come to our OPD with very high glucose levels who have absolutely no symptoms or very minimal symptoms. So the classic symptoms as they are described of diabetes, which is weight loss or increased urination or increased hunger or thirst, may be there, may be present in a lot of cases, but it's not essential that all cases of diabetes will have these symptoms. A patient may indeed be asymptomatic and still have established diabetes.
Can a person lead a normal life with diabetes?
Yes, a person can indeed lead a normal life with diabetes if the person adheres to the lifestyle changes which are supposed to be followed. If a person adheres to the medications that he is supposed to take, if the person gets his blood glucose parameters and other associated parameters at regular intervals done, and gets his medication appropriately adjusted following those investigations, then it is indeed possible for a diabetic individual to lead a perfectly normal life.
Can a person with diabetes plan a baby? Are there any precautions to take?
Diabetic individuals planning pregnancy have to be extra cautious. Prior to pregnancy, their glycemic status must be well controlled, and once the preconception glycemic level has been maintained for a certain period of time, only then will the patient be cleared, so to speak, for planning a pregnancy. So prior to planning pregnancy, the glycemic status must be well controlled. Once the pregnancy is confirmed, then again the patient must take appropriate medication and alongside lifestyle measures to make sure that the glucose level stays within limits throughout the duration of pregnancy. Pregnancy itself, as it advances, will tend to deteriorate the glycemic status in a diabetic individual, and medications must be appropriately and frequently adjusted, so as to keep the glycemic level within appropriate acceptable limits. With those precautions, a patient with diabetes can indeed undergo a normal pregnancy, but there is still a greater risk of some mishap happening during pregnancy. However, these the risks to the pregnancy can be minimized by appropriate glycemic control.